Hello everybody, my name is Akbar Soleimani. This is my Teach One assignment. I'm a health informatics graduate student at George Mason University. In this video, I want to talk briefly about sensitivity, specificity, likelihood ratio, and predictive value. This presentation was prepared as part of the HAP 671 course on healthcare database taught by Dr. Sonia Abramovic at George Mason University, Department of Health Administration and Policy. As you know, sensitivity is one of the most important concepts in healthcare. The sensitivity of a test is the ability of the test to identify correctly affected individuals. In other words, it's proportion of persons testing positive among affected individuals. So we can divide the affected persons in two parts. The first part is persons with testing positive or true positives, and the second part is persons with testing negative or false negatives. So we can calculate the sensitivity. Sensitivity is equal true positives divided by affected persons. Now, we want to see what factors influence the sensitivity of a test. We can ask, characteristics of the affected persons can affect the sensitivity of a test? The answer is yes. Antigenic characteristics of the pathogen in the area can affect of the sensitivity of a test. For example, if the test was not prepared with antigens reflecting the population of pathogens in the area, it will not pick up infected persons in the area. So, can we ask characteristics of the non-affected persons can affect on the sensitivity of a test? The answer is no. The sensitivity is estimated on a population of affected persons, not non-affected persons. What about the prevalence of the disease? The answer is again is no. The sensitivity is estimated on population of affected persons. Sensitivity is an intrinsic characteristic of the test. The second concept is a specificity. The specificity of a test is the ability of the test to identify correctly non-affected individuals. Or in other words, it's proportion of person testing negative among non-affected individuals. So we can divide that non-affected persons in two parts. The first part is persons testing negative or true negatives, and the second part is persons testing positive or false positive. So we can calculate the specificity. Specificity is equal true negatives divided by non-affected persons. Again, about the specificity, we can ask what factors can affect the specificity of a test. The characteristic of the affected person can affect on the specificity of a test? The answer is no, because the specificity is estimated on a population of non-affected, no affected persons. But in opposite of the sensitivity, characteristics of the non-affected persons can influence the specificity of a test because the diversity of, for example, antibodies to various other antigens in the population may affect cross-activity. What about the prevalence of the disease? The answer is no. because the specificity is estimated on a population of non-affected. Specificity is an intrinsic characteristic of the test. When you talk about sensitivity and specificity, you have to talk about also about cutoff values. We've been discussing sensitivity and specificity as a characteristic of a diagnostic test. However, they can be modified by the choice of the cutoff point between normal and abnormal. For diagnostic or screening tests that have continuous results, cutoff values are the dividing points on measuring scales where the test results are divided into different categories. The first one typically positive, indicating someone has the condition of the disease, or the second one negative, indicating someone does not have the condition of disease. In this figure, you can find two groups of people with blue color sick people and here with green color well people. And also you can see cutoff values here at the end of the well people and in the beginning of the sick people. But I have to say these cutoff values you can see just in the ideal case. In the normal and natural case, you cannot find ideal cutoff values here. In this figure also, you can see cutoff values in the real case, not in the ideal case. The green part, as I said before, is true negative or well people, and blue part is true positive or sick people. As you can see, inside of the true negative, we can see some false negatives. And inside of true positives, also we can see some false positives. That's why the cutoff values in the real cases are totally different with ideal case. In this shape also, you can see some true negative, this part, or people without any disease. And also you can find some people with disease or true positives. You can see this point A point, when the cutoff point from this cutoff value goes to the right, you can call all these people positive. So in cutoff A, you can see greater sensitivity, lower specificity, and more false positives. And about number B or cutoff in number B, you can see lower sensitivity, higher specificity, and more false negatives. In this slide, I want to talk about the predictive value of a positive test. The predictive value of a positive test is the probability that an individual testing positive is truly affected. In other words, it's proportion of affected persons among those testing positive. In this case also, we can divide the persons with testing positive in two parts. The first part is persons affected or true positives, and the second part is persons not affected or false positive. So if we want to talk about predictive value of a positive test, and we can produce a formula for that, then the formula is the predictive value of a positive test is true positive divided by persons testing positive. Now we have a question. What factors can affect the predictive value of a positive test? Sensitivity? The answer is yes. To some extent, sensitivity can affect on the predict value of a positive test. What about the specificity? The answer is again yes. The more the test is specific, the more it will be negative for non-affected persons. Therefore, when the test is positive, it is probably truly positive. What about the prevalence of the disease? Yes, low prevalence can affect the predictive value of a positive test, and the test will pick up more false positive. And high prevalence can affect of the predictive value of a positive test, and the test will pick up more true positives. In addition to predictive value of a positive test, also we have predictive value of a negative test. The predictive value of a negative test is the probability that an individual with testing negative is truly not affected. In other words, its proportion of not affected persons among those testing negative. Also, we can divide the person who has testing negative in two parts. The first part is persons with non-affected or true negatives, and the second part is persons affected or false negatives. And also we have a formula for predictive value of a negative test. A predictive value of a negative test is true negatives divided by persons testing negative. Now we want to see what factors can affect the predictive value of a negative test. What we can say about the sensitivity? The answer is yes. The more the test is sensitive, the more it captures affected persons. Therefore, when the test is negative, it is probably truly negative. What about the specificity? The answer is again yes, but to a lesser extent. What about the prevalence of the disease? The answer is yes. Low prevalence and high prevalence, both of them can affect the predictive value of a negative test. With low prevalence, the test will pick up more true negatives, and with high prevalence, the test will pick up more false negatives. Now, what is likelihood ratio? The likelihood ratio is the likelihood that a given test result would be expected in a patient with the target disorder compared to the likelihood that same result would be expected in a patient without the target disorder. In this slide, you can see positive likelihood ratio and negative likelihood ratio. Positive likelihood ratio is probability that a test is positive in the people without the disease. And we can calculate it with two formulas. The first one is true positive divided on all patients with disease divided by false positive divided by all patients without disease. And the second formula is sensitivity divided by 1 minus specificity. But what is negative likelihood ratio? Negative likelihood ratio is probability that a test is negative in the people with disease. And also you can find this negative likelihood ratio with two formulas. The first one, false negative divided by all patients with disease divided by true negative divided by all patients without disease. And the second formula for negative likelihood ratio is 1 minus sensitivity divided by specificity. Thank you so much for paying attention to my presentation.